We're here today with the CEO and President of Long Island Community Hospital, Mr. Richard Margulis. And we're talking about leadership and COVID-19. And there's no one really that needed to be more of a leader than someone who is heading up a hospital on the front lines during this whole pandemic. I know how active you've always been in the day-to-day activities of the hospital, so you had the facts as they were coming in. But some of what we heard was so foreign to us, it seemed like it was fiction. Was there a time that this became real to you?
Absolutely, there was. I think your phrase of it being fiction is very true. And the reality of it was that we've been through other types of situations. We're always prepared. We have a great emergency management process and policy in place. And as much as we started to talk early in January, there was still the sense that this was something that was not going to happen. And I think when we realized it was going to happen, or it was happening around us, was when we started to hear more of our patients coming in. We started to hear concerns from staff, from our medical staff. And as we started to watch the businesses close and the community start to close, sporting events take a pause, that was foreign to us. That was new territory. That was something that we were not ready for.
In the beginning, there were a lot of regulations that were coming out. Was there a moment when you realized that you were going to need to do more as a leader than just follow the regulations? That you were going to have to make some tough decisions?
That's a very good question and a very difficult question. So in any crisis situation, and in healthcare, we face a crisis quite often. Whether it's a major accident or a situation outside of the hospital, or even inside the hospital where we're prepared and ready, you always have to think it through. But as we continue to learn more about this, there was more of that concern of trying to balance the fear of the unknown to using what we know and what we do best every day, and working hard personally to not let the fear of the unknown overtake the confidence that we have in our organization and what I know we can accomplish. I don't think that there's anybody in healthcare that didn't face the reality of one day, of looking in the mirror and saying, when will I get COVID? Not if, when. And that was and can be a paralyzing moment. And I liken that to what I just said. We have the systems in place, we have the policies, procedures, we have the right people. But all of a sudden now you realize that this one is real, and this is something totally different than we've ever faced. And now we start to hear that as a state, and maybe as a country, we're not prepared. There's more questions about what ifs, and we start to think about we're on our own. And that's when I think as a leader, you have to dig down and you have to rely on what you've practiced, what you've put in place. And that, to me, many times I had to reflect back on that. And that was grounding, because that gave me the confidence in us as an organization.
The hospital has faced crises before. How was this one different from emergencies of the past?
Whenever we approach a catastrophic event, an emergency, or situation, we look at it as all hands on deck. But the reality is that some areas fall under more pressure to be able to meet the needs. I think during the pandemic, what we quickly established, learned, and implemented was that this was about everybody in our organization. It didn't matter what job you did, what contributions you made. Everything was important, and everything was magnified 100-fold, because it didn't matter whether you were at the patient's bedside doing a phenomenal job, You were stocking to make sure that we had the right PPE or procuring the right PPE, safeguarding our facilities, our supplies, our staff, thanking people for the work that they did every day, congratulating everybody when we hit it out of the park. We did all the right things, and we did it in a well-organized and in a well-fashioned way. So this was really, they talk about it takes a village. Our hospital in that regard is a village, and everybody had a significant role. Everybody played a major role here. And without it, I don't think that we would have been as successful as we were. And I think we were exceptionally successful. I think our staff did an outstanding job, absolutely outstanding.
What was the biggest challenge you saw us having to overcome?
Well, the first challenges were making sure that we had the right protective equipment. I think a significant challenge was to constantly communicate to everybody, whether that was our internal stakeholders or our external stakeholders, to make sure that not only the message of reassurance was getting out, but what we were doing, how we were adhering to policies and procedures, how we were following the CDC guidelines, how we were here to be a resource to the community, and to make sure that everybody, whether you were in the hospital or external to the hospital, you knew that you could rely on Long Island Community Hospital. I think what was an overwhelming factor for us, for me, was when you saw fear and people being scared of this pandemic. That was very challenging. I remember one morning there was a car parked in the parking lot, and there was a young lady in the car, and she was sitting in the car for a while, and I drove over to see her to make sure she was okay, and identified myself, and she was crying in the car, and I said to her, "Are you okay?" And she said, I'm afraid." I said, "Okay." And she said, I'm afraid to go to work today. I'm afraid I'm going to get sick. I'm afraid I'm going to bring this home to my family, and I'm really scared." And I looked at her, and I could see in her eyes, and I could see just from her facial expressions, that was very real. And I will tell you, that was very scary to me. And I said to her, I said, "Look, go home. It's okay. Just go home today. Just tell me who your nurse manager is, and I'll let them know that you're not able to be here today. And I appreciate it, and I hope you go home and you spend some time with your family and you feel a little better." And this person turned around to me and said, "No, I can't go home. I'm a nurse. I have to go to work today. I have to take care of my patients. I'll be okay." And I will tell you that was one of those moments where you realize where we are and what we're facing, and it made it exceptionally human and very, very real. Another moment was walking out of the hospital one night and having two people standing in the front of the hospital with balloons and signs and just doing the woo-hoos for everybody. And I knew of this couple, and I went over and I talked to them, and what they expressed was what everybody else felt. And they felt this powerlessness. And they felt that the only way that they could feel better themselves was if they came down to the hospital, stayed away from people, but just let everybody who was coming into the building and going out of the building at shift change at 7 o'clock know that they thought of them. And that too was another one of those overwhelming moments where the symbolism of what they did, their commitment to help and to pay it forward, but to think that that's where we were in 2020, and that really resonates still to this day in my mind.
So during the pandemic, a lot of people talked about rainbows and there being these moments of positivity that kept people going. So there were some really rewarding things to come out of all of this hardship. What would you say was the most rewarding?
I think it's several things. that were remarkably rewarding. Whether it was the couple that stood out front of the hospital, whether it was the community support for our hospital, the parades, people bringing things into the hospital, whether it was food or beverages for our heroes. Those were very palpable moments, and that's when you realize that the community really supports the resource in Long Island Community Hospital. What the community does not know is that hospitals function amazingly well under the most stressful circumstances. And it's during the most difficult times that people know exactly what to do and how to do it. And that's what we witnessed for months upon months, was people working together, having each other's back, caring for one another, the camaraderie that grew out of that, the cohesiveness and the support with the medical staff and working together, because we were all trying to fight through, one, the impact of this virus, two, the potential impact, the what ifs, and we were all putting together contingency plans for worst case scenario. And when people kind of put everything aside and they focus on those things, I think that was very, very, it was remarkable, because it really said what we're about. And what we're about is caring for people every day. We use the Courageous Hearts, tag in our branding and our advertising, and we do. We have courageous hearts here. Everybody's a courageous heart. Everybody earned their courageous heart during this pandemic, but we all came together, and we're that much more closer now than we were before.
Personally, what do you feel kept you going every day?
I think the team did and does a great job all the time. And I think what motivated me was I just wanted to be here to support the team.
How did you look to motivate your employees?
I think the community motivated our employees, really. The support from the community was overwhelming, and it didn't matter whether it was food that was donated to us, letters, posters, school-age children sending us letters, people making masks, people just standing playing music in the courtyard when the change of shift occurred, the parades, as I talked about. Those were the things that were very, very rewarding and overwhelming for the entire organization. I think the community coming together with the Knapp family COVID crisis challenge, and for us to be able to raise $1 million in less than a month's time, was a symbol of the community's recognition of what we were going through and what we were dealing with every day. And that was not wasted on the staff. The staff felt that, and I think that became a motivator to the staff as well.
How did you look to influence your community during this?
By modeling good health practices, by not only being here for the community, but making sure that we wear masks, we wash our hands, we're kind to people, we socially distance, adopting all of those practices that the experts tell us would make a difference, or told us that would make a difference. And I think that's what we did. We modeled great behavior with a professional spirit, and enthusiasm to be able to get through this.
Where do you see us going next as an organization?
We learned from this experience. We'll be better. I think our next steps are to continue to grow, to continue to be a resource for our community, to try to move beyond COVID right now, to try to get back to being the community steward, being a healthcare provider, to be able to start to focus the community on their general health care, and maybe some of the things that they did not have the opportunity to take care of during the last 16 months. That's my hope.
Thank you so much for sharing your time with us and for all of your insight.